got several things to talk about today in addition to COVID. Let me begin by just talking for a minute about yesterday's election. Congratulations to Alderwoman Kara Spencer and Treasurer Tashara Jones, who are were both approved to move on to the April mayoral election on April the 6th. So we offer them congratulations. I personally will do everything in my power to help them be successful, and I am certainly rooting for whoever the next mayor is to be successful for our city, because that affects all of us. I also want to congratulate, there were 16 wards yesterday who had aldermen up for election. All but 3 of them had opposition, and so the top 2 vote getters in each of those wards will advance to the April election as well. So it was St. Louis's first time doing this thing called approval voting, which meant that you could vote for as many candidates as you wanted. There were, for example, 4 mayoral candidates. When you went in to vote, you could vote for 1 or 2 or 3 or all 4 of them. Probably nobody voted for all 4, but we don't actually know that. So the top 2 vote getters then are the ones that move on to the general election about a month from now. And so that is big news for St. Louis. And I would just say this, I always say congratulations and best of luck to anybody who has the nerve to put their name on a ballot. That is an experience, running for office, whether you're at the local level or at a higher level. That's an experience that very few people will ever have. And I know there are lots and lots of opinions out there, because I get lots of those opinions. And, often they are from people who probably have not run for office. So I just, my hat's off to anybody who is willing to take a stand, take a risk, put their name out there, to try to implement what they believe in and to make their ward or their city a better city. So hats off to all of the candidates yesterday. Let's see, what else? Let's talk about COVID for a minute and then vaccinations. So the COVID numbers continue to be good. The city's 14-day positivity rate has dropped to about 4%. That's good. It's not quite that low in the region, but that's still good. Yesterday, we reported 15 new COVID positive cases. Our 7-day average is 20 new cases a day. So the last 2 days, 15 was one day, 10 was the other. We had a few days in there last week where we ticked up to having almost 30 cases a day. And that's why we look at averages, and our 7-day averages is at 20 new cases a day today. Now, in terms of people in the hospital, also some good news there. There are, this information is 2 days old, but there are 304 people in the hospital right now who are either COVID positive or suspected positive. Of those 304 people, 69 of them are in the ICU, and of those people, 50 people are on ventilators. So still some pretty sick people out there, but much better numbers. If we just look back to, let me see here. If we just look back to February the 2nd, we had begun to tick downward at that point in time, but we were still averaging 53 cases a day, just, what would that be, 28 days ago or 30 days ago. So that's good news. Please continue to wear your mask, socially distance, just to be sure that, there are a lot of variants circling out there. Don't know how prevalent they are, concerned that they might become more prevalent. So please use the mitigation strategies that you all know about. Now, with regard to vaccinations, I mentioned this on Monday, but we do have a vaccination event this Saturday. It's at Carpenter's Hall, 1401 South Hampton. It's by invitation only, and you have to have an appointment. today, a lot of people received either a text message or an email, if you had signed up on our list, to invite you to sign up for Saturday. So, excuse me. So, we try to vaccinate at each of our events over 2,000 people. It's interesting. We've had situations where people would sign up for an event, sign up for an appointment rather, and then not show up for the event. So please, if you do sign up for an appointment, be sure to show up to get the actual vaccine. These will be first doses given out on this Saturday, and of course we'll be back I believe these are going to be Moderna shots, but we will be back in 4 weeks then to give the second one. When you get your first shot, I think you all know this, you each get a card that says what vaccine you got and what date you got it and when your next vaccination, your second vaccination will be. So, we are receiving more vaccine in the city of St. Louis. This week we got almost 3,000 doses.
You're muted.
I'm sorry, I was muted. Where did I?
3,000 vaccine.
This week, we got 3,000 vaccinations. We were expecting 900. We got 3,000. That's great. We're not complaining about that. We had spoke with the governor on Monday of this week, and he has promised more vaccination, more vaccine for our urban area here. Sorry, you guys are choking me up today. And we got it. So our vaccination event, in case I was muted, is this Saturday. It's appointment only. Many people did get an invitation this morning during the day today, either by text or by email, to sign up for an appointment. If you do get an appointment, please be sure to show up for it. We have had some folks take appointments and then not be there. That causes us to scramble, and it takes a spot. And I know sometimes something might come up where you can't, but make every effort if you can to be there on that day at your appointed time or close to it. So thank you all for your cooperation with that. So that's COVID numbers, vaccinations. We expect to continue to get more vaccine, and we need it because we still have a lot of people that are in phase 1B, tier 2, meaning over 65 or with underlying health conditions who still need to get the vaccination. In 2 weeks, about 2 weeks, the governor has opened up a third tier. It's called tier 3, and which includes teachers and grocery store workers, etc. We are right now trying to figure out how can we get the over 65s or the people with underlying health conditions, how can we get the majority or as many as possible of them vaccinated before opening up to teachers, although we understand that vaccinating teachers is very, very important as well. So we expect to begin to get a lot more vaccine. Yesterday, President Biden said that there should be enough vaccine by the end of May, which is only 3 months, March, April, and May, to vaccinate everybody who wants a vaccination. So as you can see, to meet that goal, we're going to be getting a lot more vaccine in the next few weeks. That's good. We're happy about that. Okay, That's COVID, that's vaccinations. What else was I going to talk about today? Oh, I mentioned the election, yesterday's election, but just very briefly, looking forward to the April election, one of the things that will be on the ballot on the April election is the confirming the earnings tax. Anybody who lives or works in the city of St. Louis or has a business in the city of St. Louis pays a 1% earnings tax. That is 36% of our budget. That's a lot of money. It was 175 or 80 million dollars last year. And so because of a constitutional amendment about 10 or 11 years ago, we have to re-vote on that every 5 years. And so this 5-year period is this year. It's in April. You'll hear more about this. I would just say certainly very important for us to have the earnings tax revenue in order just to continue to provide basic services, police, fire, EMS, trash pickup, parks, 36% of your revenue. Just imagine, a one-third, over a third of your budget being cut. And so we're hoping for and expect that the voters of St. Louis will understand how important this is and vote to retain the earnings tax. So there'll be more about that later, but we started a committee this week. Collector of Revenue Greg Daly and I each came together to start a committee to make sure that we could educate and inform voters about the importance of the earnings tax by April. So that, and then one last thing. This is an update on the CARES Act money. Someone asked me this question a week or two ago, and so we got some updated numbers. We've spent $5.3 million of the CARES Act money to help our small businesses. There were 1,070 small businesses all across the city, in every ward, who each got $5,000 in grants. We know $5,000 isn't a huge amount of money. These were all small businesses, though, businesses with fewer than 20 employees, 25 employees, I believe it was. And so that was helpful to them. And, we hope to be able to do more for small businesses as the funds that are being worked through Congress right now, if those are passed, then there'll be some additional funding for small businesses. So that's all I have for today. Are there questions?
Okay, a couple of questions today, Mayor. So on the state moving to 1B Tier 3, do you have any insight on why that's happening when the places like the city of St. Louis haven't been able to get all the way through 1B Tier 2?
Well, I don't know exactly why the state decided to open that up, but I'll speculate a little bit. Number one, everybody wants to get kids back in school. And teachers are part of Phase 1B Tier 3. And so the push to do that, how important that is, of course, influenced the state's desire to vaccinate teachers and get kids back in school. Most kids are in school somewhat, some are hybrid, but it's just an important thing to do. There are counties in the state that have a higher percentage of their Tier 2 people vaccinated than we do. And of course, we know that St. Louis and St. Louis County, we have St. Louis County is the largest county in the state with 1 million people, close to it. City of St. Louis with 300,000. So we have a lot of older people and a lot of people with underlying health conditions. So, we need the vaccine to catch up with vaccinating those folks.
Jim has a question about whether or not the city is still considered a vaccine desert because rural towns seem to have been receiving more vaccine than urban areas.
Yeah, Jim, that's kind of the same question. It's just what we just talked about here. Vaccine desert, I mean, that's we don't have enough vaccine. Let me just say that. The state has allocated vaccine by highway patrol districts, but right here in the city of St. Louis. And that's frankly why, one of the reasons we had the conversation with the governor on Monday, and likely why we got 3,000 doses this week instead of the 900 that that we were expecting. So we're expecting to continue to get more, and we need more doses to federally qualified health centers, more doses to hospitals, and hospitals are getting more this week. More doses to our local public health agencies. We just need more doses overall to get more people vaccinated.
We do have a question on small business and general public health restrictions. Will capacity restrictions be revisited or lifted? This is from James. Be revisited or lifted soon?
James, it's something that we are looking at now. We talked about this at the pandemic task force yesterday, and there hasn't been a decision made on that, but if numbers continue to go like they have been, then I would expect we would have some increased capacity.
Oh, you might be muted. Oh, no, you're not. Okay. We also got a question about the state's report that mentioned this is a question from Russell about the state report that indicated that the city of St. Louis had a wide vaccine gap, and if current levels will be addressed, vaccine availability will be strengthened to meet that gap.
Yeah, I think that's the same question as the last two. Yes, we have a lot of people that are over 65 who still need to be vaccinated, a lot of people with underlying health conditions which still need to be vaccinated, and we do need more vaccine. We did get 3,000 doses this week, right at 3,000 doses, but that needs to continue week after week so that we can close that gap.
Janie is inquiring about the notification system about senior citizens who don't have access to a computer and how they can make sure that they are registered.
If they should call 657-1499, and that's a call to our health department, and they can register in that way. If they have no ability to register either via their phone or maybe a neighbor or a relative who can help them register. A lot of people have done that, but we know that there's a gap there. We're trying to fill that gap. Last Saturday we had an event, as you probably know, at the Omega Center, and I was there talking with folks, and there were any number of people who told me, yes, I got a call from the health department because they had registered over the phone, and the health department called them and invited them in that way. So that can happen.
I think that is it for new questions, Mayor.
Okay, well, that's it for questions today. Thank you all. It's a beautiful day out there. Try to get out, take a walk around the block. Thank you all for being with us, and we'll be back and talk with you again shortly. Thank you.